directions on children's over-the-counter medications can be confusing, and it can lead to overdoses. A new study in the Journal of the American Medical Association looked at 200 top-selling children's medicines, from cold and allergy to pain and gastrointestinal medications. It found serious problems between the dosage labeling and the measuring devices they come with. Dr. Marcus DeGraw, a pediatrician from St. John's Hospital, joins us now with kind of what parents can do and what the problem really is. And staggering, really, when you look at this statistic, Dr. McGraw, 98.6% of medications had inconsistencies between the directions on the box and the dosing. What did they find? What's going on?
Well, it can be for several different reasons. There can be inconsistencies amongst brands for the abbreviations that they use for teaspoons or milliliters. It could be that you have a dropper that only goes to 0.8 milliliters, but the instructions say to give 1.2. So parents have to decide, how much am I supposed to give my child when the dropper only goes up to half or 3/4 of that
And you
dose.
want to take the thought out of it for them, instead of them making them do the math.
Correct.
The easier the better for kids.
Correct. I mean, even in a hospital, they're making things more simple for physicians, but they haven't made things simple for parents at home. So the guidelines that were established within the last couple of years, we're trying to make things much more simple for parents trying to give their kids medications.
Okay, in the meantime, I know as a mom with two young kids, out of all the measuring cups, the ones that just have lines that aren't super specific, I like the one that we're showing right there. It's got the dark lettering on it, you can see it.
Sure.
Is that, as a doctor, what you like to see, I guess?
Yeah, those work well, but even with those, the black markings can become scratched off,
yeah.
And especially if there's a decimal point, the decimal point can be removed, and then, again, dosing can be confused.
But even we're learning in even some of these cases, right, that where some of the lines are might not actually be completely accurate?
Correct.
So what is a parent to do? That's the big takeaway from this. What do you do?
Well, what I do and what we try to do in our office is actually give droppers that we use in the hospital, or syringes that have very clearly marked demarcations about the measurements. And then we obviously know also that the dosing is exact, that those measurements with the syringes that we're using is exact. Rather than having to pour into a cup, we can use a syringe and then give it to the child from that perspective.
Is it also, real quickly in closing, important to use the dosage that came with the bottle you got?
Absolutely.
It is.
Absolutely.
So do that if you can't get one of those droppers or something from a parent. So,
absolutely.
All right, Dr. DeGraw, thank you very much for being with us.
Thank you for having me.
Okay, you have a wonderful night.
Thank
Diana?
You.